Hi, I'm Joyce. I'm a physical therapist working at Physical Therapy First, and today I'm going to show you glute med progression strengthening physical therapy first PTF tip of the week. The gluteus medius are two lateral hip stabilizers. They're part of the gluteal package. You've got the gluteus maximus, medius and minimus on the side, and this is what we're going to focus on to prevent any lateral motion excessively when you're walking or when you're doing sports. Excessive lateral motion of the hips, so when you stand out and cock, you're going to find that you have a muscle imbalance, and when you have too much lateral excursion, that changes the center of weight and can lead to different pathologies, including femoral knee tracking, low back pain, IT band syndrome, amongst others. So what I'm going to show you is a very easy progression of exercise, starting with something that Alex Tan showed you a couple weeks ago with the hip stabilizers and the Sideline Clamshell. I'm going to bring Bree in, and she's going to demonstrate the exercises for us. So go ahead and lie on your side. She's going to lay on her side. Hips and knees are going to be just gently bent. Now, the initial exercise that Alex showed you last week was that the knees will open, the feet staying together. So this is an easy non-resistance exercise. Adding the rubber band is going to add resistance. So you want to make sure that you're not compensating by rolling the trunk as you do this, so I recommend you holding your hip, stabilizing, paying attention to your back not rotating posteriorly. You're going to keep your feet together and stretch the band open as far as you can, and then gently allow the band to close. That is clam 1. Clam 2. Again, Alex had mentioned keeping the knees together and then lifting the bottom leg, or the top leg, excuse me, and then slowly controlling that motion as well. I'm going to fast forward to this to clam 3. You're going to lift this leg so it's parallel to the ground, and you're going to maintain that lift parallel as you again rotate your lower leg towards the ceiling, slowly lowering, and repetitions of 10 are oftentimes what we would be doing. So try to maintain that elevation and just lift the leg. And just slow and controlled. If you find that the knee is moving all over the place, you should bring your leg down, relax, and do fewer repetitions with rests in between. The last one is clamshell 4. You're going to extend the hips fully now.
Yeah, I'm almost done with that.
Again, making sure that there's no motion in the upper body. You're going to elevate this leg parallel and extend it. So parallel to the floor, extended from the hip. And you're going to lift the foot towards the ceiling, maintaining the elevation of the upper leg bone and then lowering. So it's just this internal rotation, this lifting of the foot, up and back. And the last exercise that I'm about to show you is going to be a progression in standing. This is called a closed chain exercise, and it's using the physio ball. It's kind of a hybrid plank, but you're not side laying and bearing weight through your arm and upper body, which a lot of people aren't able to do. You're going to bring the physio ball along the length of the thigh bone. So a little bit lower, so it's just kind of between the hip and the knee, actually. A little bit lower, and you want to walk yourself close to the ball, maintaining a neutral stance, so feet are parallel, hip distance apart, and you don't want this outer hip, the one away from the ball, you do not want it to be bent or cocked inwards. You want to be straight from this outside foot, from foot to shoulder. Now, the leg against the ball is simply pressing the ball against the wall. It's just holding. The muscle or the leg we're working out is going to be the standing leg. I want you to keep your left leg straight at the hip and just bend the knee backward. All right, bend the can a little bit further back. If someone needed assistance, we would give them maybe a chair or something to maintain a little bit of some light fingertip assistance so they're not struggling so firmly with their balance. This is a challenging balance exercise as it is on the stabilizing standing leg, so you can do maybe 5 or 10 second holds here. Now we're going to progress this into a mini squat. When you do a mini squat, you're trying to dip down, maintaining a neutral knee over the toe. She's going to extend her arms forward to give her better balance. And she's just going to dip down just slightly and right back up. The point of this is not the depth unless you're able to sustain a neutral pelvis. So slow dip, neutral pelvis, neither side dips down or up, knee stays in line with the foot. And there you go, a nice progression. Again, repetitions of 10, working up to maybe 3 sets of 10, breaks as you need. Thank you for watching this PTF tip of the week. If you have any questions or comments, please don't hesitate to call us or visit our website. Thank you.